Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. You can get a hold of me, Jason, at intricateartseminars.com. Today I just wanted to talk to everybody about erectile dysfunction. This is a massive problem for a huge amount of men in the United States. So per the statistics, about 40% of guys at the age of 40 have some sort of erectile dysfunction problems. Doesn't need to be full-blown erectile dysfunction, could be minor issues, could be being able to get an erection and then losing the erection. And there's just a few primary causes for that, right? So unfortunately, again, 40% of guys in the United States at the age of 40 have some type of erectile dysfunction. That number goes up 10% per decade. So 50% of 50-year-olds, 60% of 60-year-olds. So if we just say that the average age of death in the United States is about 80, so let's just assume that half of the men in this country have some sort of erectile dysfunction. If 40% of guys, more or less, we're talking about 40 to 50% of all men in the United States are suffering from some type of erectile dysfunction. If you assume there's 330 million people in the United States, divide that by 2 for men and women, and then half it again, that's about 80 million guys, right? Somewhere around there. That is an insane number of people that are suffering needlessly. The vast majority of those people suffering from erectile dysfunction should not be. Now, there's a lot of reasons that erectile dysfunction can happen, but there's a couple of primary overriding factors that typically cause erectile dysfunction. So what I usually tell my students in class and what I tell my patients, and I have a huge amount of success treating this with dry needling and joint manipulation, is that if you don't have some sort of underlying pathology like uncontrolled type 2 diabetes or type 1 diabetes, some sort of structural damage, if you have a seriously enlarged prostate or something like that, but the vast majority of men suffering from erectile dysfunction are suffering needlessly. So let's go over why. So number one, there's just a couple of ways that guys have problems with getting an erection, right? So the way that this works is that enough blood needs to be going to the penis and enter the penis for the pressure to block the venous valves and close off the veins, right? So if you guys remember, inside veins, there's these little valves like this. So if the heart's up here, right? If we're just thinking about me, heart's up here, wee-wee's down here, right? The veins have valves like this, and the veins get blood back to the heart by muscle contraction and relaxation, and the blood gets pushed up the veins, the valves open, and then they shut so the blood can't go back. What needs to happen with erection is enough arterial blood, so enough blood going into the penis overcomes the pressure gradient and just shuts the veins off, and it shuts the valves and it closes the veins down so blood can't go backwards, right? If there's enough blood going to the penis and there's not blood coming back out, you get an erection and you maintain an erection. The problem that people have either with not getting an erection or being able to get an erection and then lose it is, number one, there's either not enough blood going to the penis in the first place, or there's somewhat sufficient blood going to the penis, but the pressure inside the penis does not get big enough, does not reach a high enough level where it shuts off the backflow of blood. So you can either have not enough blood or you can have blood leaking out, right? Why does this happen? This is one of the very counterintuitive things about erections, right? So most guys would think, or most people would think, that an erection is a sympathetic nervous system response. So it just makes sense, right? Guys get excited, you get an erection, you want to have sex. You would think that that would be a sympathetic response because typically when we get excited, our sympathetic nervous system goes up, and that is true. However, an erection in guys is primarily parasympathetic. So what needs to happen is you need to get enough vasodilation, so opening up of the arteries to allow a rush of blood to go down there, which creates that pressure gradient and shuts off the veins, right? The problem is that with too much sympathetic hyperactivity, which is what most human beings are living with, remember, the human body just responds naturally to mental and physical stress, strain, and trauma by elevating the sympathetic. So we'll get to that in 1 second. But as far as the erection goes, we know that sympathetic hyperactivity causes distal vasoconstriction, and it causes chronic muscle tonicity. It causes tissue hypoxia. It reduces the overall amount of blood flow. I'm talking in a chronic situation. And chronic sympathetic hyperactivity should only be considered over 3 days or so, right? The human body is not made to be in chronic sympathetic hyperactivity. Unfortunately, most human beings are, and that's one of the massive widespread problems in our healthcare system, and it's not addressed basically at all. And that's really unfortunate because it's easy to address, at least in a couple of ways, right? So my theory on primarily why men typically around the age of 40 or 50 begin to experience erectile dysfunction is that if we look at human evolution, right, regardless of what your thoughts are on where people came from, I think most people can agree that humans have been around on this planet for a long, long time. If you look at the death statistics, the average age worldwide of death in 1950 was about 50 years old. So human beings have only had about 70 years out of the thousands and thousands of years of our evolution to practice being over 50 years old, right? So the human body has not developed the ability to self-regulate its nervous system past 50 very well. So we start to see lots of unusual things start to happen when we're in our 40s or 50s, both guys and girls, right? Girls have different symptoms. Headaches is a big one for guys too, but let's just stick with erectile dysfunction. So again, my thought is that at the age of 40 or 50, since evolutionarily speaking, we have not had practice being alive that long, it just so happens that our sympathetic nervous system, which is hyperactive in the vast majority of people, especially in the United States, for 40 years, or let's just say somewhere around the age of 10, you start to get sympathetic hyperactivity, right? So for 30 or 40 years, our body is in chronic, constant sympathetic hyperactivity. The areas of the body that are going to be the most reciprocally inhibited by sympathetic hyperactivity are the most parasympathetically innervated structures in the body. So remember, typically the sympathetic and parasympathetic systems are on like a seesaw. The sympathetics go up, the parasympathetics kind of level it out. If the body gets stuck in chronic sympathetic hyperactivity, that reciprocally inhibits parasympathetic function. And the areas that are most highly innervated by parasympathetic structures are the pelvic floor, the organs, and the upper cervical spine in the brain, right? So the problem that we have with chronic sympathetic hyperactivity is that it's going to chronically inhibit parasympathetic activity. And again, because the human body and mind don't have experience living over the age of 50 for more than 70 years or so, that chronic sympathetic hyperactivity somewhere around midlife just starts to really cause problems because the parasympathetics have been reciprocally inhibited for so long. As far as erections go, the primary problem with erection is your muscles are too tight, sympathetics are too high, the parasympathetics can't vasodilate the arteries and vessels and the muscles down there. So the muscles are just end up in this rigid, tonically hypoxic state without oxygen. They get too much carbon dioxide in there, pain amplifying chemicals happen, there's too much calcium in the cells, muscles can't contract, there's excessive release of acetylcholine, there's not enough production of acetylcholinesterase to gobble up the acetylcholine, and the muscles just stay chronically contracted. So the primary problem with erectile dysfunction is chronic sympathetic hyperactivity that's leading to chronic muscle tightness, muscle rigidity, and a lack of blood flow. The only medication that is common for erectile dysfunction is a pill that guys have to take for the rest of their lives. And this is really unfortunate. This is like a lot of issues that people get treated for, completely unnecessary to take pills for it. because there's another option. So Viagra, or whatever the brand names are, that was typically developed as a heart medication to vasodilate arteries in the heart. They just found that it did a better job at vasodilating arteries in the pelvic floor, especially with guys. So vasodilation is a parasympathetic activity, right? So the way that Viagra works is not through targeting the parasympathetic specifically, it's through targeting the nitrous oxide pathway, which helps vasodilate arteries, right? Well, dry needling, if you target the parasympathetic autonomic nervous system specifically, so the vagus nerve distribution in the ears, the upper cervical spine, the sacral plexus, and the pelvic floor muscles together, that has a profound homeostatic effect on the autonomic nervous system via direct parasympathetic stimulation via the vagus nerve in the ear, and as direct as we can via the upper cervical spine and the pelvic floor musculature itself, right? So by targeting the vagus nerve and the parasympathetics, as well as targeting the tight tissues in the pelvic floor. So with guys, typically the primary two muscles that need to be able to swell with blood and contract and relax are the bulbal spongiosus and the ischiocavernosus. So the two muscles closest to the base of the penis, and the bulbal spongiosus is on the base of the penis, right? So if those muscles are rigid and tight, you're not going to be able to get blood going in and out of the muscles. You're not going to be able to get enough blood going in there to maintain or even form an erection. And the reason is simply a sympathetically hyperactive nervous system that is inhibiting blood flow, inhibiting muscle function. Two of the most common things that we see in research as far as dry needling goes, and two of the most objective things that we know about dry needling, is that it's an extremely good way to normalize tissue length, and it's an extremely good way to increase blood flow, and that's all via its effect on the autonomic nervous system. So needling overall has a sympathetic depressive and a parasympathetic elevating effect, especially if you know what you're doing with the needles and you can directly treat the pelvic floor muscles, which is extremely comfortable, by the way, you guys. If any guys are out there listening to this, I know the idea of sticking a needle in your crotch is like just freaking horrible. It is the most comfortable area in the body to be needled. I get needled down there all the time, and I'm a wimp with the needles typically. I barely feel them down there. It's extremely relaxing, right? So it's not just those muscles. We target the pelvic floor muscles, back muscles, all sorts of stuff, but specifically those couple muscles. If you target the parasympathetic autonomic nervous system, I have a huge success rate with treating erectile dysfunction. And the reason is that by needling and by manipulating joints following needling to put the spine back into neutral and the pelvis back into neutral, you allow the body to function how it should. It's not that the body can't get an erection, it's that it's being inhibited from getting an erection via sympathetic hyperactivity and chronic muscle tonicity. Again, Viagra is just targeting the nitrous oxide pathway. It does nothing to actually address the cause of the problem. It's a temporary band-aid like almost all medication is, and that's not an accident, right? The lovely pharmaceutical companies don't want anything that works too well, and if they find something, they don't use it, right? So with needling and joint manipulation, by directly targeting the reason that the muscles are being inhibited and the reason the blood flow is not sufficient, you actually cure the problem. You can get complete resolution of erectile dysfunction in the vast majority of guys that are suffering from it, barring any significant underlying pathology, again, like a prolapse or like some sort of structural damage. Most people are suffering from erectile dysfunction from the simple fact of chronic sympathetic hyperactivity causing muscle rigidity, hypoxia, and a decrease in blood flow. We know that dry needling increases blood flow. It has a homeostatic effect on the autonomic nervous system via sympathetic depression, parasympathetic elevation. Dry needling combined with joint manipulation should be the primary tool in medicine to treat and resolve erectile dysfunction. It's extremely effective. Right? If any guys are listening to this out there that have any questions about this, or if you're a PT or an OT or a medical doctor that would like training in this, please let me know. Again, you can read some of our blogs at intricateartseminars.com on the blog tab, and you can get a hold of me there. Thanks.